Hi guys, good morning. Today we are going to discuss regarding the new topic is refractive errors or the refraction. Hope you all know the basics, and you may have problems associated with these types of uses, and many of you are using the specs also. So we can see one by one. So in a normal vision, the image will be getting rays will be getting reflected from the image, and it passes through the lens, and image will be focused on the retina. That is a normal process of vision, and the term is emmetropia. The emmetropia can be defined as a state of refraction when the parallel rays of light coming from the infinity are focused at the sensitive layer of the retina, with the accommodation being at rest. That is the normal conditions. Emmetropia can be defined as a state of refraction when the parallel rays of light coming from the infinity are focused at the sensitive layer of the retina, with the accommodation being at rest. Coming to the term diopter. The diopter is the standard unit to express the refractive power of the optical lenses and the reciprocal of the distance between the lens and its focus. That is the diopter. It's a standard unit to express the refractive power of the optical lens. Thus, if the focal length of the lens is 0.20 meter, that 20 centimeter, its power is diopter is 5D, then 1 bar. That's in between the lens. That is 1 by 0.20. That will be equal to 5D. That is the power of that particular lens. Then accommodation. It is the ability of the lens to change the refraction of light as it passes through the eye by changing the curvature of the lens of the eye, and the stimulus, that is ability of the eye to change the refraction of light as it passes through the eye by changing the curvature of the lens by the eye. Stimulus, blurred retinal image, then contraction of the ciliary muscles, relaxation of the sonular fibers, and thickening of the lens, and increased refractive power. These are the stimulus which may produce the accommodation. Then the refractive errors are the emmetropia. The emmetropia is normal power of refraction, and the emmetropia is refractive errors. It is defined as a state of refraction. It is defined as a state of refraction when the parallel rays of light coming from infinity are focused either in front or behind the sensitive layer of the retina. Normally, the image will be focused on the retina, and in emmetropia or in refractive errors, either the image will be in front of the retina or behind the retina. That is the errors of refraction. The common signs and symptoms of the refractive errors are the cardinal sign is decreased visual acuity. Then astigmatism, that is weakness of easy fatigability of the eyes. Then headache, discomfort should be related to the use of the eyes and relieved when the eyes are not in use. That is the common signs and symptoms. Then the refractive errors, mainly hyperopia, myopia, astigmatism, presbyopia, aphakia, and anisometropia. Hyperopia means that is the farsightedness. Then myopia, nearsightedness. The objects which are close to the eye will be more visible, and more strain will be required for farsight. That is the myopia. Then the myopia is two types, that is axial and refractive. Abnormality in the length of the eye, and refractive means abnormality in the refractive power of the cornea or the lens. Then the astigmatism, it is the unequal refracting power of the lens in different meridians, and the presbyopia, decreased accommodation with aging. Then aphakia, that is the absence of the crystalline lenses. Then anisometropia, that is inequality in the refractive power of the two eyes. These are the common refractive errors. So we can see each one. First one is the hypermetropia. That is, from the image that you can identify that the particular image will be focused behind the retina. That is the hypermetropia, wherein the parallel rays of the light coming from the infinity are focused behind the retina with accommodation being at rest, and thus the posterior focal point is behind the retina, then receives the blurred image. That is the hypermetropia. It's clear that. From the particular image, the light rays will be converging, and then the eye lens has the large focal length and hence has less converging power, and thus the image will be focused behind the retina. Etiological factors, that is mainly the four things, that is the axial hypermetropia, curvatural hypermetropia, index hypermetropia, and absence of the lens or the aphakia. The axial hypermetropia is by the far the commonest form, and it occurs due to short axial length of the eyeball. Axial hypermetropia means far the commonest form, and it occurs due to the short axial length of the eyeball. Then the curvatural hypermetropia, that occurs due to the comparatively flatter curvature of the cornea or the lens or both. It occurs due to flatter curvature of the cornea or lens or both. Then the index hypermetropia results due to change in the refractive index of the lens. It's due to the change in the refractive index of the lens. Then the absence of the lens, that is aphakia, either congenitally or acquired following surgical removal of the lens, leads to high hypermetropia. The hyperopia is the same itself, and the refractive condition in which the accommodation, suspense, and parallel rays of light are intercepted by the retina, and image will be focused behind the retina only, and it's usually due to eyeball that is too short, or the axial hypermetropia, and the lens system that is too weak, that is refractive hypermetropia. Image will be focusing behind the retina only. The same thing itself, the etiological factors are axial hypermetropia, curvatural, index hypermetropia, position hypermetropia, and the absence of the crystalline lenses or the aphakia. Then the signs and symptoms of hyperopia are that may be asymptomatic, then asthenopic symptoms, then defective vision, then size of the eyeball will be small, then anterior chamber will be comparatively small. In normal vision, the image will be forming the retina, and in hyperopia, we are using the in order to correct this particular case, we will be using the convex lens to correct the farsightedness, and in case of the myopia, we will be using the concave lens. Usually we will be using the convex and concave lens, and in hyperopia, convex lens will be using, and in order to correct the problem, that is the farsightedness, and in myopia we will be using the concave lens, and we will be correcting the nearsightedness. Then aphakia, the lens has been removed, that is the aphakia. Then pseudoaphakia means a lens implant has been put in during the cataract surgery, that is the pseudoaphakia. The crystalline lens is displaced and not in line with the visual axis. Lens will be displaced and it will not be in the visual axis, that is the aphakia. The causes are surgical removal or secondary to trauma and lead to severe hyperopia and loss of accommodation. The chief symptoms are decreased vision for both the near and far objects, means the lens is not in position, and no symptoms of the ocular discomfort since accommodation is not possible. Then, diagnosis: loss of reflected images from the surface of the lens or excessive movement of the iris because of the loss of support of the anterior lens capsule. These are the things in the aphakia. And we have to correct by intraocular lenses and placed immediately behind the iris after the extracapsular cataract extraction, and additional convex lens is required for near work. Next one is the myopia, that is the nearsightedness, the optical condition in which the rays of light entering the eye parallel to the visual axis come to focus in front of the retina, and usually due to eyeball that is too long, that is the axial myopia, or a lens system that is too short, that is the refractive myopia. These are the things in the myopia. Coming to the etiology factors, that are mainly the three things: axial myopia, curvature myopia, and index myopia. The axial myopia results from the increase in the anterior posterior length of the eyeball. Then the curvatural myopia occurs due to increased curvature of the cornea, lens, or both. Curvature myopia occurs due to increased curvature of the cornea, lens, or both. Then the index myopia results from the increase in the refractive index of the crystalline lens associated with nuclear sclerosis. Increase in the refractive index of the crystalline lens which is associated with nuclear sclerosis. Then coming to the types, that is the physiological, pathological, and the lenticular myopia. In the physiological myopia, that is axial and refractive, and mainly it is caused due to inadequate correction of the refractive power of the cornea and lens with the length of the globe, and it usually onset between the 5 to 10 years up to 25 years and gradually increases until the 18 years, or when the eye is fully grown, and seldom it exceeds 6 diopters. Means the power will be exceeding in the 6 diopters. And the pathological or degenerative myopia, that is the axial, this is the pathological or degenerative myopia. The axial length of the eye is excessive because of the overgrowth of the posterior 2/3 of the globe, and it commonly begins as a physiological myopia, and more than 6 diopters will be the power, and the eye continues to enlarge rather than the stabilizing when the globe is adult size. Then the lenticular means that is a refractive, and due to increased refractive power of the crystalline lens or the anterior segment, there will be the problem with the myopia, and the occurs in the uncontrolled diabetes, the nuclear sclerosis, or aging, and drugs in cases of the hydrolyzine, chlorothiazide, or the phenothiazines. These are the main types and the leading causes for the different types of myopia. We will be correcting the myopia with a concave lens, and the image will be focused correctly on the retina. The concave lens will diverge the light rays, and this is opposite to the effect in the convex lens, and it causes the peripheral light rays to diverge from the light rays and pass through the center of the lens, and then the image will be focused on the retina. In the radial keratotomy, these are the surgical options or surgical corrections for the refractive errors. The more commonly performed before the use of the excimer lasers, and the surgical procedure used to decrease the myopia by 2 to 6 diopters. The procedure is less predictable and less stable than the laser vision corrections. Then the refractive keratectomy, that is original excimer laser procedures for reshaping the cornea, and the laser is applied to the surface of the cornea after the epithelium is removed, and the discomfort is greater and the visual recovery prolonged compared to LASIK. And the change of the range of the refractive errors which can be corrected by the PRK or the photokeratic keratectomy is also not as wide as that of the LASIK. Means a minor will be corrected and not the major ones. In the LASIK, that is the laser assisted in situ keratomiliosis, a surgical procedure intended to reduce a person's dependency on the glasses or contact lenses, and the most commonly performed as a cure for myopia, but can also be used to cure the hyperopia or astigmatism, and permanently changes the shape of the cornea using a special laser, and thus focusing the light rays exactly on the retina. Then this is an ambulatory procedure. And using the crystalline lenses consisting of layers of the transparent proteins having the different optical densities, and acts as a series of lenses within the lens and lens capsule, and the total refractive index is greater than that of the individual layers. Means we will be using the crystalline lenses which will be having the consisting of the transparent proteins that having the different optical densities,